record it. I just click record. So we'll also record this if it ends up being helpful or useful for folks that weren't able to be here. We'll make sure they have the opportunity to watch as well. First, thanks for being here. We wanted to give this a try. I know this is it's challenging in the best of times to have all staff meetings. This is a whole new format and environment with a whole new kind of world reality happening right now. So appreciate all you making the time to try and make this connection. We just felt it was really important to at least come together. You know, we've all been working incredibly hard in our different arenas, and just want to be able to have an opportunity to, my cat back there, have an opportunity to touch base, check on each other, make sure that we're all on the same page, be able to address, you know, the communication has been pretty one way. I've been trying to do updates that are you know, pretty overview oriented, because I know there's tons of information coming from your specific programs, and it's just, you know, can be overwhelming and we're all saturated. But we want to at least create an opportunity now to touch base. And I've asked Julie and Dr. Plum, our medical director, to both be here and host also, assuming that we'll have some questions around sort of protocols and how we're kind of managing the pandemic as an organization, and as it relates to the broader community. So they'll be able to answer some questions as well. And really the agenda was really driven by us asking for questions, and we did get a few questions, and so we'll cover that here shortly. But mostly, again, just wanting to just really start with saying thank you. This all came really fast. This hit the entire country and our agency and our community. You know, within days, we were a completely different agency. And so a lot of work from all of you went into making that happen, allowing us to continue to serve folks. I think it's been clear from the beginning. Well, it wasn't clear at the beginning, but it became clear pretty quickly that that our work was not only deemed essential, but even has a higher level category of you know, essential to sustain life. And so there was a special executive order mandating our type of organizations around the state to remain open. And the subsequent days, we've just had to be really connected to the state. I can get into some of that, you know, to the degree that we want to get into the weeds on what that means, but making sure that we're following the right protocols. But before this ever happened, our primary concern at our agency has always been care of clients and care of staff and safety. That's you know, been a priority of ours all along. This tested that, certainly, and so you know, we moved fast to work towards that end. I did ask Julie if she could just, there's been, you know, a few questions just around some of the protocols. Those are changing daily, whether it's at our organization, whether it's at hospitals, whether it's at grocery stores, just the general community, different executive orders there. I mean, you see how fast things are changing. So I did ask Julie, based on a couple of the questions and just kind of based at this moment in time, where we're at with some of those protocols. So I thought, Julie, if we could start there. And again, anybody that has questions, please either just unmute as long as that stays manageable, or put a question in the chat. So Julie, do you mind going over your points?
Sure, I can talk to where we currently stand. As Chris said, we have had the safety of both staff and clients in the forefront from the very beginning of this. But week by week, as this has progressed, we've had to get tighter and safer and more thoughtful and more cautious with our process. So I can tell you where we are as of today. A couple of things we've done. This is with the help of Dr. Plum, of course. I don't want to leave her out of this. We are, and I also want to mention, we're not making this up as we go along. We are reviewing CDC recommendations, local health department recommendations. We're also both employed at Munson and able to see their daily updates, policies, procedures, and have kind of taken some of our thoughts and the things that we've put into place at ATS from Munson. I think they've done a phenomenal job of staying ahead of this and keeping the hospital really safe. So some of the things we're doing is we have tightened up the screening process even more. We started screening people potential clients several weeks ago, but now we've got several layers of screening with even tighter screening questions. So the initial point of contact is with Access for a client. Access has a set list of questions that they have to ask. When those the answers to those questions or the responses to those questions then go directly to Paula and or Susan, depending on the program that the client is looking for. And they case those directly. I know Access used to have a little bit of liberty of just putting people on the schedule, but Paula and Susan are directly involved with every single client now in scheduling them and doing way more work on the forefront of that. And then once the client arrives, they get re-screened again with a whole screening process that most of you that work in the residences are going to be familiar with. And then those are sent to me and I review those. So we've also asked for some time, a little bit more of a time lag to be able to make those decisions so we can make them as carefully and cautiously as possible. Some of those questions include the county of residence, the amount of travel that client has had, current or recent symptoms that they've had, known COVID contacts, and if they've been to a hospital or provider recently and for what reason. We also have this week, Sunday at Detox, yesterday at Phoenix, and today at DeKoski started universal masking. I think this goes without saying, this is just for everybody's safety, to try to reduce the amount of droplets in the air as much as we can. So we reached out to the community, we got a really good response, and we have more than enough masks for everybody, cloth masks, I should say. For every staff and client. And in case you need a new one or are wondering where they are, Kim will have the bulk of the supply at 1010. Something else we need to be doing, and this will kind of require work from everybody at that residences, is on discharge. We want to make sure client contact information is updated so they know where they're going, or we know where they're going, excuse me. If down the road we have a client that later on does test positive for COVID, their local health department will do all the tracking and tracing and figure out where they've been. So that is, we would be contacted by their health department if anything were to come up later. And then of course, you know, under the direction of our local health department, put in place any procedures that would need to be done if necessary. I guess that's about it. We're constantly working on getting more supplies. We're not short on gloves, but I've already ordered some because I know we won't get any till June at the earliest. We're continuing to order masks, continuing to have those orders canceled, and continuing to order masks. So I guess that's where we stand.
On that note, Julie, is care of these cloth masks included when folks get one?
I sent out messaging to the managers, Paula, Susan, Andrea, Karen, Jackie, with messaging for staff that includes care, storage, when to replace,
Okay.
all that stuff. And then the second page was messaging to clients, which is care, storage, ask a staff member if you need a new one.
Okay.
So the managers got it. It wasn't like an all staff email though.
Okay.
Who asked that? Was it you,
Yeah.
Rachel?
Yeah, that was me.
Yeah. So we want people to take their mask and then to take care of it, just because we don't know when we're going to get more replacement masks. We do have a call out, and so folks continue to donate the cloth masks, that's fantastic, and we are appreciating the community support. But we just got to put protocols in so that we can maintain those and keep them in the paper bags. I think, Julie, am I correct? Not a plastic bag, but a paper bag.
The CDC is recommending paper bag because plastic bags will retain moisture.
Right. Okay. Dr. Plum, is there anything that you want to add to that? Not to put you on the spot, but in terms of anything or what you're kind of seeing in the community and or at Munson?
So I have, the landscape has changed so dramatically that I have not physically been at the hospital, though I have been on call and covering the inpatient psychiatric unit on multiple occasions. So even now, if I have to do a consult in the emergency department, it's done remotely, which is hard for me to even wrap my head around. But so I guess I just would like to say that I understand that it's uncomfortable to wear the masks. I went running this morning with a friend and we were 8 feet apart and I wore my homemade cloth mask and it was very weird. And it's a strange feeling and I can appreciate that it doesn't feel good, but I guess the way I look at it is we are protecting we're protecting everybody else and ourselves by everybody wearing them. So especially the population that we care for is vulnerable.
Right.
And I'm sure many of us have ourselves compromised immune systems or friends or family that we live with that have compromised immune systems. And so doing that protects them too.
Right.
So I just would like to give a good thank you to Julie for all the work that she has done on this. And I think that we've done a really good job in carefully following guidelines and being thoughtful about what we're doing.
Right. And I know both of you in particular, because you're still connected to Munson, you've been able to be in a lot of their kind of briefings and the information they're putting out, which has been really helpful. It's been helpful to me in conversing with you all. So I know it's informing your decisions. And so I appreciate that from both of you.
Yeah, they have provider forums on Monday, Wednesday, Friday from 12:30 to 1. And I try to tune in to at least part of it a couple times a week, but they're very useful in terms of things like, how many ICU beds we have, how many isolation beds, and what's happening in the community. I think the last time I listened was last Friday. So.
And Julie said this week there was one from the infectious disease specialist. Is that right, Julie?
Yeah, I caught yesterday's. It was Mark Cannon and Megan Preby. So she's the head of infectious disease, I think nursing wise, and he's a physician in infectious disease and just had like the most up to date. I mean, it's better than watching the news. You feel like you're a day or two ahead of the news with drugs that they're trialing and the antibody screening. And it's been very valuable. Yesterday's was really good.
Right. And I just bring that up because I appreciate that that's the information you're drawing upon in making these decisions for our agency. So.
Yeah, our decisions have not been fear-based. They have been evidence-based.
Correct.
That's a good point. Thank you.
Are there other thoughts or questions relative to those comments for Dr. Plum or for Julie around protocols that we have in place? I don't see any in the chat. I'll take that as a no.
I guess I could address one concern that I think both I've had, and I know that people who are, at work currently wearing masks have had, was that, some people are at home and some people are on the front lines. And it's been uncomfortable for me as a doctor to not be present with my patients. But I can also understand that it's very uncomfortable for people to have close proximity to patients in this situation. The way I see it is, if a job can be done remotely, it protects many people to have that job done remotely. So that's the way I kind of look at it, is not on an individual basis, but on a population basis. So then every person that I don't have contact with, who then doesn't have contact and doesn't have contact, and it all goes down the line. So anything we can do to minimize that contact, we should. And then there are some jobs where you just can't. The nurse at the hospital, the caregivers at Phoenix. So please know that I very much respect those that are there on the front lines with personal protective equipment on.
Well said. And that's the and that was part of the clarifying. The governor put out 2 orders. The second one was very specific to that. So we had our access team still working out of the admin building, and we had some other roles, but it was a really clear message. And then, and we had to submit a plan to the state and justify each position that wasn't at home full time. So we had to go that far to say that, or to put in whether we were partially. So like most of the admin right now is partially, like, and I'm there at least a little bit most days, and some of us are coming back and forth, but we had to state the reasons, even if it was partial, that we had to do that. And so it is uncomfortable, and we understand the inequity of that for sure, and the selflessness of our folks to continue to come into the programs every day. That's important work. Let me. So I'll pause again before we kind of move away from more of Julie, Dr. Plum's expertise and our medical expertise. We can always come back to it, but just want to make sure there weren't sort of questions around that. All right. And thank you for that, adding that, Dr. Plum. So let me, so then I guess I'll just address some of the other questions that came in. I think that's kind of the way forward next here. And so we didn't get a ton of questions, but the ones that did come in were sort of clustered around themes. The most common question, just to start there, was around additional pay for frontline staff. And there really isn't an answer for that at this point. All I can say is our fight right now, to be 100% frank with everybody, is keeping our agency alive. We are a couple payrolls out of not existing. There's optimism to think that we're going to get some help here, but we have not seen a penny from NMRE or from the federal government at this point. And to do the simple math of we're running at about half census also. And for us, our break even is when we're running about 90% census. Not to, so it is, we had to submit a projection. And so we project, and again, I know it's awkward to talk about money, but that's what this is about, right? But I mean, it's about $250,000 between May and June if we sort of stay on this trajectory that we will lose, which is essentially what we're asking help for from the Medicaid office. So there's some indication from the federal level that they do not want this provider network. It is not unique to us. Our margins in this field, we don't set Medicaid rates. It's a couple percent every month. Any given month, and most of the, folks in management know that. They see our financials. Those have been at our board meetings. We run a tight organization based on what our reimbursement rates are. And this year wasn't a particularly great year for us to start with. We just ended, our fiscal year ends in October. So we just finished up all our audit. So at this point, that's our priority, is that we can still be here for our clients in our community. Should these funds materialize, then that is a conversation we'll have with the board. And I think I alluded to that in an earlier email. I didn't want to be afraid of addressing that question because it came up a number of times from folks. To the best of my knowledge, that isn't a thing yet that's happening. I can say that we've been advocating. I've been with multiple state agencies on the phone, obviously with Anna Marie. I have another meeting with Anna Marie tomorrow. I can also say that I have had now 2 conversations with Senator Gary Peters' office. And if you've been following that, he has submitted a bill that adds additional funding for frontline workers. And so we were able to give feedback to that. I spent a 20 minutes, half hour a few days ago with a staffer there just prior to him submitting that bill. And then I even got a call back for further clarification. So they're taking that seriously, but that's, again, federal money that may or may not come our way. So I really don't know how else to address that, but to say that I remain optimistic, I remain hopeful, but right now we're in a fight for our lives in terms of staying afloat. I've talked with probably 90% of the treatment centers around the state in one way or another, and we're all pretty much in the same boat. I don't think the state of Michigan or the federal Medicaid office is going to allow the network to fall apart, but how that gets remedied, I don't know yet. Politico just today did a article around, I think they interviewed the Surgeon General and even got quotes from the president about how important they think our work is going to be at the other side of this. Especially when you see the increase in folks enrolling for Medicaid, which is primarily our population, it's going to go up 40%. That means a lot of folks that needed our service that didn't have it before are going to be seeking it. And so we need to be strong and ready for that. I need you to know that we're doing everything we can. The exec team has been meeting every morning for an hour at 8:30 every single morning for an hour or so. And we always leave with action plans. We always leave with, new decisions and, kind of working around the clock. It's a weird, it's this weird dynamic of being, a combination of Zoom meetings and then in the office meetings and trying to figure stuff out. But, I think everybody in the agency is working hard. So that's a long answer to say I don't have an answer on any sort of hazard or additional pay at this point. We're not covering payroll as it is. So we're looking for help, but I think it's coming. We just have to keep advocating. So, can I be any more specific on that? Are there any questions in particular around that? I'm just really grateful for the folks that we aren't in the highest paid field to begin with, and you guys are coming in every day. It's pretty incredible. And I know the sacrifice you're making for with your families in mind and for our clients in mind. I talked to Jeff O'Brien, Chief of Police, today, and he expressed their willingness, their mostly gratitude for us. He's seen a lot of people struggle and seeing the same thing that we're seeing, people being afraid to go anywhere. Urgent cares are empty, the ER is slow, people are just hunkering down and being scared. And so we know at some point this is people are gonna seek us out. We know that's happening. I also got a couple questions. So sometimes it's hard to know whether a question or two is representative of bigger questions or if more people have the same question. But I did get two questions around: are we planning on closing down and laying people off? So in other words, intentionally closing down. And I just to reiterate again, that's clear. We aren't. We have a mandate to stay open. So I don't know how else to address that. I did address that one of the updates, but in terms of is our plan to shut down programs at this point? No. The path was a little bit different because that sort of emptied out, and for really, lots of factors went into it, but one is that the Department of Corrections was just really trying to get rid of folks in a jail setting, and then that didn't become viable for us. But then that also allowed us to have some bench staff that we could train to work in the programs. So that was a little bit different in that regard. But in terms of the residential and the detox and other programs, recovery homes, at this point, no. Staffing is, we're just hoping we can do what we can do to support you all in ways that create safety for you and clients, and that we'll get over this peak. We think the peak is coming here shortly. There's good data that some of these factors are working. But in testing increased this week. I think just starting today, and so we assume that positives will go up just because we have a pretty significant increase in testing capability around the state and in the region. So we'll assume that numbers are going to go up because so many folks are probably either haven't been able to meet the criteria for testing at this point. I think I had another question around client that I didn't quite understand. It was, I don't know if Tracy's even on here, but about are we holding clients accountable after they leave? And I don't know if that's a question about tracking them, but I refer back to Julie's comment about we're trying to get contact information for folks so that they can be part of the mapping if they become symptomatic or someone that they came in contact with is. And then also we had a couple questions around, or I had a question just around how is the programming looking? And so that I don't know, that was kind of a last minute question that came in, is are we keeping up with our NMRE requirements, our Medicaid essentially requirements? And I don't know if Susan or Bill or Jackie want to speak to that, but I can say two things. One is I think we mostly are, meaning that we'll get, we don't have to worry about not getting funded. But I also think there's going to be some leeway in all of this. We haven't been told that, but I'm proud that we've been able to really put some innovative strategies in place to make sure folks are still getting their required programming in. I've talked to, again, other agencies around the state, and that's been a big challenge for them is trying to maintain a the appropriate level of programming when folks are really just kind of worried about the basic sort of safety needs. So I'm proud of what we've been able to do and some of the pieces that we've been able to do it through the porch and those sort of things. And I think we're going to continue to try and bolster that up a little bit. Bill and or Susan, do you have any thoughts about programming, or how's it going in terms of the outpatient and then the residential programs? Bill, do you mind?
Absolutely. Programming is continued per usual. If anything, we've increased services. Jamie has helped in adding 4 process groups, which are available groups to aid in the recovery homes, because a lot of those guys are struggling, as we know, due to lack of social contact beyond those that are in the house. We have individuals that are in IOP and OP. So we've the standards and criteria that we met before, we continue to meet. So, and we're still bringing new clients in for outpatient services and offering groups, like I said. So, really not a whole lot of change, just a hybrid between those that are in the office and those that are at home.
Great. And I've just at least heard anecdotally that clients seem to be responding really well to that type of interaction.
The remoteness of a lot of our clients, such as Muncie County, Kalkaska County, we serve so many different counties. I mean, this just allows them to receive services where rides in before they couldn't be done. So we've been with the remote workings of the majority of the therapists. If we do have a no show on the ASI, they just simply get on the phone and call the next person in line. So we've been pulling a lot of people forward. So it's really worked out well for increasing client contact and time to services. So.
Okay, great. Thank you for that. That was a quick transition. So nice job getting that all together.
Yeah, thanks for all the help. So.
Right. Susan, can you speak to how it's going in residential? Oh, can't hear you.
I'm not seeing audio coming from Susan.
Okay. All right. Yeah, you're unmuted, but I can see that you're. Oh, sorry, Susan. Maybe. Sorry about that. If there's something that feels important or relevant, maybe you could just type it in the chat if it's, or otherwise we'll just, yeah, I can't seem to change that for you either. I see volume in your microphone, but it's just not coming through.
I tried got the same result.
Okay. Hey, Paula, do you mind telling us, you're kind of the front line there too with detox and all the screenings. Can you give us a little bit of update of what's happening?
Sure. Julie and I started talking about this process about last week, early in the week, just to kind of up the, as Julie had indicated and Dr. Plum, just kind of provide more safety protocol for ourselves and for our residents. And it is definitely a learning curve for me, being a kind of a social worker and getting to work, or I guess Julie's been very helpful just kind of giving me the guidelines, but we have, I mean, there has been some pretty consistent asking people to quarantine prior to coming in to detox, primarily because of going to like leaving their own county or being around people who have had symptoms. And that census itself, people, I mean, we're not nearly getting the numbers of people calling in as we used to, or as I think what we're used to. But then on top of that, taking the safety precautions to ask those questions multiple times, but then also the second time around, when I get the screening and then when Susan gets the screening for residential, we're kind of delving more into, more people's living circumstances to get more information of kind of what we're dealing with. But as of today, I know I did 3 screens today. We did 3 admits to detox today. And I think and Susan and I have 3 casings that are looking at possibly going to residential. So I think in the last week between myself, Julie, and Susan and Access, we're all just kind of getting the process streamlined, going from there. But I think it definitely goes against the grain of a lot of our beliefs of, we're so used to getting people in and getting them in fast. And that has kind of had to go to the wayside because of safety issues and wanting to know the process.
Right.
So, yeah.
Good. Well, and thank you for that. That's you're one of those primary touch points for folks looking for services. So, and thanks for sort of reminding me, bringing that up. So one of the less comfortable parts of the job is fielding some emails. Not all of them have been pleasant, to be frank, and that's okay. But a couple have made an assertion that I want to address directly, and that is that we are making decisions based on finances before safety. And that could not be further from the truth. And that needs to be said, that safety of our clients and the safety of our staff is at the forefront of every morning meeting that we're having. All of these policies, like Dr. Plum said, coming from science. Yes, there's a financial implication, but we are saying no to folks, and we are putting screenings in, and that, like Paula said, that is against our entire agency's DNA. That's not who we are. We are the agency in this state that says yes whenever we can, and so that's been tough. But I think it's just important to understand that we would be in a different financial situation if we prioritize differently, if that were really the priority. So I just want to be able to say that frankly, and I hope the few emails that I got aren't representative, especially because we're a for-profit. Nobody here is making any more money the more clients we take, right? That's not how it works. And so I hope that sentiment is understood and shared throughout. That addresses at least the questions that I have received. One did come in on the chat from Tim Carlisle, that just a clarification, that said, so all employees should be wearing masks inside our facilities? And the answer to that is yes. From now on, everybody should have a mask, been issued a mask and a paper bag, and follow Julie's instructions that were sent. Yeah, yes, or were they were already sent? Is that correct, Julie, to everybody?
The instructions were sent to managers, but
Oh,
if everyone would like, I can
That's right.
I can do an all staff. I wasn't sure. I was kind of letting the manager of each house.
I think that's good.
Yeah, well, we wanted the mask availability and the messaging to roll out at the same time, not, them to be a day or two apart. So that's why they were kind of staggered.
Right.
Each startup was a different day this week.
Right.
But the managers each have the attachment. If any of you guys need it, I can resend it.
No, I think that I think managers are on top of it. So everybody,
Okay.
The message, everybody should have a mask in a bag and get clarity from your manager per your program on how to take care of that. So we have a response from Susan via Brad. Programming in residential has continued as usual for core programming. We have had very dedicated staff to keep the healing happening. Clients continue to get excellent clinical care. Life skills are more challenges as this includes AA and NA meetings. Those continue to happen every night, and we have been able to participate in Zoom meetings. We have plugged in things like meditation, hikes, walks, yoga, and during the previous life skill spots in our schedule. And then I also got a question that said, should we be worried that we won't be working soon, since you said we're a couple paychecks away from company failing? So that's why I wanted to be straightforward, so I'll address that again. That is where we are right now. I am very optimistic that we will still remain. I'm more addressing that to also say we have no funds to pay any additional hazard pay or whatever it's being called at this point without any additional help. So no, I don't think our demise is imminent, but I appreciate the question because that is a scary thing, and I think in other maybe organizations or in other belief systems that wouldn't be a thing that gets said out loud. But I feel like being transparent is part of how we all get through this. I don't know if put Larry and or Dave on the spot, and you can shake your heads no. That's fine. Oh, Larry, you can anyway, so I won't do that. I won't put you on the spot. But that's the gist of that situation. No, we are looking at only, we have financial obligations, and our primary financial obligation is to our staff and our payroll. So that's what we look at. If we don't pay, Relias for a month, well, so be it. But our staff are going to get paid, and that's our priority. So,
Chris?
Yes.
Yeah, I just want to let you know that on the financial end, our top priority is this funding.
Yes.
We're working on it. Top priority. We're on top of it. Anything comes in, any possible funding, we jump right on it. We get the paperwork done, and I'm pretty optimistic that we're going to get some.
And I am too. And I'm sorry that many of you are meeting Dave for the first time, right there. But I can say that last week was a transition. Larry and Dave were both in the office, and the three of us spent a good amount of time working on the funding piece of things. That was our priority. In fact, a lot of the orientation that we had planned for Dave didn't happen because we were working on that piece. So we've applied to federal stimulus programs. We have submitted a request to Medicaid. We have extended our line of credit with the banks, which is helpful, but that's a loan. So we've done things to put ourselves. In fact, we were one of, as far as we know, we were one of the first agencies, businesses in the state, in the region, to apply for the Payroll Protection Act. So we were before at least any of the treatment centers that I talked to that are still trying to get in. We had it opened on Friday, and we had an application submitted by Sunday. We worked on Saturday getting all of that documentation in, worked with our banker. So please know that everything we can do is being done, to Dave's point. And Dave's done a great job jumping in. This is a weird time for a CFO transition, but I think you can hang some comfort on Dave's optimism as well. Any more? And in the van, Tim, says the face mask. So I just went to Costco this recently for the first time, and I've really kind of been avoiding that. And boy, they have things down to a science with they route you exactly where you need to go in the produce aisle, and people 6 feet on either side of you. So I also want to say that as I've spoken with other treatment centers around the state, I would say from a transition standpoint, and this shouldn't surprise those of you that have been around our organization for a while, that we kind of were ahead of the curve. We have been asked a lot of advice on how we did certain things. We have a lot of talent in our IT department, for instance, with Mark and John, to be able to make some of these moves happen. We have a medical expertise that we did not have 2 years ago, that has really helped us. We have, clinical management team that is stronger now than it had been, any point previous. So we have a lot of the right things in place that are helping us, I think, really do the best we can in this sort of awkward, uncomfortable situation. I think we are as stable. It's another way to say it. We are as operationally stable, as tough as it is, as awkward as it is, as any organization I've talked to. Everyone's handling it a little bit different, but we're all now mostly on the same page. We've all dropped census to some degree. Some did it radically and then got in trouble by the state. But most have dropped census, either intentionally for social distancing reasons. And now what seems to be happening around the state is what's happening with us, is that census is just naturally declining, because folks are just not, I think they're struggling at home. And so that really speaks to, what we have to be on the other side of this, and how we probably need to really fortify some of our outpatient services so that we can be there for folks. Is there anybody else that wants to either give an update from their perspective? I don't want to put anybody else on the spot. That's really not fair with so many people, but or have questions that they want to ask of myself or Dr. Plum, Julie, anything that I'm missing for you. And if you want to chat, I think there's a way to even do it privately, and I don't have to say your name if you want to be anonymous to everybody else but me.
I think, can you guys hear me now?
Hey, Susan, there you are.
Hi, hello. I just wanted to speak very quickly to the universal masking that got implemented at Phoenix yesterday and Decaski today. That it went very well, and that yes, there's been instructions given to staff and clients about how to care for that and store it, and that overall the reception to that was that of just gratitude, and knowing that was coming from a safety perspective. As with any behavioral health change, we're going to have to do our behavioral health work with implementing a new habit for staff as well. But I think that it was received very well. So I just wanted to give that update.
Good. Yeah, that's an awkward thing I'm sure a lot of folks to have to wear those around, and so good. I'm glad that went well.
I think it's made a lot of people feel, and I hope for staff to feel, that there is another added safety precaution and protection in place. So.
Right. How about from that perspective, are there things that you all feel that we can do, I mean, we know we have limitations on masks that we can get. We know there's limits on being able to get, more disinfectant wipes and that sort of thing. I mean, that's, everybody's dealing with that. But does anybody else have any other thoughts or questions around safety measures or protocols?
I don't see any.
Okay. I think what we are doing is comprehensive, and it's really the best that we can do with what we have. How about, it's an awkward question to ask over this computer screen, but how are we doing? How are your coworkers doing? What can the agency do to support you? What can we do to help you support your work family? We're moving 100 miles an hour, and so it's easy to, not take care of ourselves. That's our problem on any given day, but in this environment, even more so important. Are there thoughts folks can share on that? Okay.
I could just say one thing, that I had a visit, Tuesday mornings is my ATS clinic, and I saw a woman who I'm treating for depression, and I had adjusted her medication last time I saw her, and I was talking to her, and she goes, I don't even know how we can tell if it's working or not with everything that's going on. And I think she's really right that nothing is normal right now. And I think all of our reactions to this are very individual. And we probably see it in ourselves and our coworkers and our family members and our children, whose lives have completely changed, which many of you who have children at home can appreciate it. I have an 11-year-old moping in the other room right now, and after this I'm going to take him for a little walk on his skateboard. I mean, things have changed drastically for all of us, and so I think it's just to give ourselves and each other the space to have emotions surrounding it, because it is definitely unlike anything I think any of us have ever lived through. I mean, the last time there was a pandemic like this was 1918, which was a year after my grandfather, who has passed away, was born. So over 100 years ago.
Right.
I don't know if that's helpful or not, but I would just say give yourselves another space, because it is a abnormal time for sure.
Yeah, and I think that's it. It is. We're all handling it so differently. Who I am today is very different than who I was a week ago, and 3 weeks ago, you all didn't want to talk to that guy. So I mean, we're all just sort of evolving through this. I get it. Andrea gave an update that Phoenix, and maybe you all can read this, but I'll read it anyway. I'm not sure. Phoenix staff's been amazing through all of this. We've really pulled together to help one another and are constantly checking in on the basics. How are you doing? Our Phoenix family is holding strong. Brad posted, Susan is extremely supportive and encouraging to self-care. And as our Phoenix intern, Joanna would say, onward COVID Avengers. So it is, I think I put in one of my emails something about, especially, so we have this, there's a disadvantage that I've been griping about for years around our organization, how geographically segregated we are. It's hard to run an organization operationally. But at a time like this, I also think that strengthens our family bonds. You know, the bonds between the staff at Detox, bonds between the staff that are under the Phoenix roof and at Dukoski. Those are what I know are getting you all through. I remember those days well. I've never lived through anything like this, as any of us have, but I know how important that those relationships are, and I'm glad you have them. So I want to support those as well. so as you think of things that might be helpful in that, you know, I can't imagine what that might be right now, but I you know that the agency wants to support that. I want to support that for you. I want you to know that not only are you working incredibly hard, but that the rest of the agency is too. That us in the admin are. You know, I saw Kim yesterday when I was over there, and she's still flitting around as fast as Kim does. You know, Maggie, Julie, and I were on a meeting for an hour today, working through employee health things. There's a lot happening, a lot of hard work happening to keep the agency operational. But the most important thing that's happening is the client care that we've changed, but we haven't really, you know, missed a beat. We're still there for folks, and that does take us caring for each other through that. So I appreciate and applaud all of this. You know, how long this goes on, how many more weeks, I don't know, obviously, but we know that this isn't going to be the way that it is forever. Warmer weather's coming. You know, we're seeing encouraging news, I think, about, you know, some treatments and some increased testing and some antibody testing, and you know, we just got to remain hopeful in that. Sorry, wrong buttons. Are there any other? I keep flicking around, and Tim, your picture is just this. It's just a great, happy picture. It keeps making me smile when I see it. You're just, you know, everyone else is kind of straight face, bobbing their head, and then I look and there's this nice static picture of you smiling like you just won the chili cook-off. So appreciate that. Hey, Zarelli, do you want to say anything about anything going on at the porch?
You hear me?
There you go.
Hey, how's it going, everybody?
Good. I know you're never at a loss for words, so.
Well, we're trying to keep the spirit of the porch alive as best we can with online content. We've got a regular check-in every morning at 10:30 with Maddie and I, where we talk about the things that we have planned for the day. We've been adding we have like a little morning show, Facebook Live that we do. We've been adding meditation, some exercise stuff, some interviews with people like Tori Worth and Nancy Dow was on this week. We're going to have Paul Bach from Munson on this week. We had Lisa Anderson on. So we're trying to offer as many things as possible through the website, but with the physical space closed, that's really all we can do. Another important note is that our safe syringe program at the porch is still operating on a curbside basis, and we do have naloxone kits that are available on a curbside basis as well. That basically looks like just coming by, ringing the doorbell, have people contact Maddie or I if they want to stop by and pick up any of those items. Other than that, we've just been trying to get the word out there. A cool thing that happened this week was Grand Traverse Distillery, of all people, reached out with they're apparently creating massive quantities of this hand sanitizer in their facilities through donations. I guess there's other breweries that are donating, you know, kegs of beer that they can't sell, and the distillery takes them and breaks them down into hand sanitizer, and they've been donating those to us for all of our facilities. They basically made the commitment that they're going to do that indefinitely until we get through this lockdown time, which is really cool. And we say all the time that, you know, when you ask for help, you never know where you're going to get it. So that's an unusual reply, I guess, but it's been really helpful. And we still have calls out for masks. We were on a fan meeting, Families Against Narcotics meeting the other day. There were people all throughout the state that were on that meeting, and we were talking about our need for masks. There are people from other counties that are sending us packages of masks, handmade DIY masks this week. So we're just trying to stay connected as best we can with, it's kind of difficult because you get used to seeing people coming into the porch for meetings and activities, and then you just don't see them. We don't know where they're at. So another thing that we've done is we've opened up the opportunity for people to let us know If there's anybody that they know that needs a call or a check-in or just needs somebody to check in on them, or if they want to be that person that makes the call to check in on people, we're open to that, and we're starting to see some responses there. Maddie and I are kind of spearheading that project as well. So if you can think of anything that you would like to see on the Facebook channel over at the porch that would help either the residential clients or people you know in the community or you, just let us know.
Okay. Thank you. I got a call this afternoon from a local reporter from the Northern Express, and he just wanted a quote about another story he was running, just, you know, but it was basically just he wanted another source, another soundbite. But then we ended up talking, and so it looks like it might be in a few weeks, but when I kind of laid out the impact that this is having on our field and how folks are struggling in the community, and how agencies like ours are on a fee-for-service basis, meaning we don't get paid until less people come in, and that, I mean, which has always been something we've advocated against. And so it looks like that is going to now, so he said, okay, I'm not going to use your quote now, but to do a bigger story on that in particular. So hopefully that is helpful for us too, just to get our message out on, really a bigger public health message, you know, especially when we talked about being at a crossroads of trying to manage two epidemics. And so he got pretty committed to that. So I feel like I'll let folks know, but I think that will be a feature in a couple of weeks that we can look forward to. So I know you, Matt and Maddie have done a lot of good media stuff over the last few months, and so that's carrying a lot of folks through this too. I don't see any more chats. Any other questions or comments or thoughts or concerns? I want to make sure we address anything that you have. I know this is, again, an odd format, but I'm very grateful that you all took the time to be here. I think we'll try and do this again if it makes sense, and maybe in a couple of weeks, or we'll see how things change. But maybe, you know, maybe do it every 2 weeks or so. You know, the world may be different by then, maybe not. You know, we've been at this a month now, so, you know, I can't believe that this is the 14th of April already. Some day, I think I said this before, some days it feels like it's going by, you know, slow as molasses, and some days it's just, I think I told somebody today, I don't know if I'm working 5-hour days or 15-hour days, because it's all just sort of, it's always on. I'm sure that, you know, it's everything right now, right? So I get that. I get what we're all going through. Last call. Any
Feels
last words?
Feels like we covered it pretty well. So
Okay.
I don't have anything further to add.
Okay. Wait, I got one chat here. I like to meet in 2 weeks again, idea from Tim. Okay. I think we'll plan on that. So I guess lastly, just it feels trite to express my gratitude, but it's there. I know this is trying times for all of us. This is professionally has to be the most significant work any of us will ever do prior to this or after this. We are in the moment that is going to test us all, and that will define us all. And I'm proud of how we're managing it at this point, both, you know, from an agency level, but just everyone that I've been working with, and hearing about, you know, through all parts of the agency. So I'm proud to be part of this organization, and I'm proud to work alongside you, and I'm grateful that the folks in our in our community, and that the folks that we serve are have access to us. It's pretty amazing. It really is. So thank you for all your efforts.
I think we are signing off now. Thanks, everybody.
Okay, thanks all. Have a good evening.